Hello, everyone. Today is March 4th of 2022, and I'm here with Dr. Rebecca Katz. And Rebecca, I'll turn it over to you if you want to introduce yourself and tell us a little bit about your background and what you have been working on regarding pandemic response.
Thank you, Emily. And it's fun to be on this side since I've had to do so many of the interviews on the other side. So I'm Rebecca Katz. I am a professor at Georgetown University, and I direct the Center for Global Health Science and Security. I think like many other people throughout the pandemic, I've worn multiple hats, and I'll talk a little bit about those in a second. This entire project actually came out of a class that I was teaching in the fall of 21. And so really excited to now be part of it and to continue it moving forward. You know, as you said, it's now March 2022. And honestly, it's been hard to arrange my thoughts on what's happened over the past 2 years. And I will no doubt forget things. But it's been, I think, like for many of us in the field, it's been a really overwhelming, busy couple of years. I think, I spent 20 years working on pandemic preparedness. So when the pandemic hit, it was time to go into motion. And that's taken a lot of different forms. So very early on, starting from the first kind of indications coming out of China of a novel coronavirus, we started watching very carefully, started doing initial writings, because one of the things that a lot of my scholarship had been on the international health regulations and the declaration of a pandemic, of a public health emergency of international concern, and the difference between that and a pandemic. So immediately got to writing, published a very early piece on just describing what the announcement meant and what was to come. And that was in I think, February 2020, maybe even January. Started doing a lot of writing, immediately started using my emerging infectious disease course as kind of a space where I was talking to the students and trying to figure out, okay, well, what is happening? How I taught everything. We then flipped into that. The first meeting of Georgetown University's kind of emergency task force was held on Martin Luther King Jr. Day. So that was the start of what became daily meetings in trying to think about how the institution needed to be responding and what to be monitoring. I very early became involved with the Big East, the athletic conference, and trying to figure out, how to keep what was happening, explaining that to the coaches, to the university presidents, trying to stop the Big East basketball tournament. Apologies to everybody. As well as doing a lot of early press. So I remember Valentine's Day 2020 being on CNN and starting to talk about and trying to help start to explain what was happening. I think very early on, I've been working on this stuff for 20 years to a very small niche audience. And suddenly people were reading papers that I'd written on things like quarantine. And so that led to also, I'm doing an NPR interview on work that I'd done on quarantine. And everyone's saying, well, why didn't you do more? I'm like, well, because nobody cared. So it was really hard. So I think, starting to very early on translate the scholarship and work that we've done for years into what does this mean for actual response. Starting in late February of 2020, I started doing what ended up being daily webinars mostly for the business community on the translation, explaining what was happening. That led into a lot of very not policy work, but actual how to keep people safe work in the public health community. I think a lot of us were brought that for every organization, because every organization had to figure out how it was going to keep its people safe, what its obligations were, what were the best decisions that they should be making. That then also led, so I was basically giving public health. So there was my policy work, there's my scholarship, and then giving public health advice. And that ranged from large multinational corporations to mayors, to governors, to universities. So it was really all over the place. And then in March of 2020, the center, we launched an initiative along with colleagues at NTI and Center for Global Development on something called COVID Local, because there was an abdication of federal leadership in the response, all the local jurisdictions were really struggling with what to do. So we put together basically a guide for local level decision makers, almost like a checklist on what they should be thinking about. That then led to coming up with a set of metrics for opening, closing, reopening. And what was really neat about that effort was it kind of forced a lot of the academics and civil society groups that were all doing this. We were all doing this flat out, right? But to come together to say, like, listen, we don't all have to agree, but we have to at least have a narrative to understand why my metrics might be different than Harvard's metrics, might be different than Resolve to Save Lives metrics. And I think it really was a neat opportunity for a large portion of the community to come together to figure out, all right, we're all doing this kind of individual one-on-one stuff, but how do we collectively support the communities, the country, the world? So again, lots of like individual advising. I was on the Seattle Mayor's Task Force, talked to the Nevada governor. There was, again, lots of this kind of regular advising on, but most of that was really just helping to explain what was happening and what the kind of the best guidance was going forward on how to keep people safe. Around that same time, around late March of 2020, I was asked to become one of the public health advisors to the Biden campaign. And at that point, I was like, I'm a public health advisor to health. I'm a public health advisor to everybody. Sure, bring it up. What's one more thing? Right? And I think what was interesting about that is that these issues of pandemic preparedness and global health security had always been political, but they had never been partisan. And so I had no experience working on a campaign, on anything. It was just not part of my world. So, but I got to come on board. And again, that wasn't really policy. That was very much like the nuts and bolts of how do we keep campaign workers safe? What are the decisions that should be being made? And at the same time doing all of this work, also ramping up on the scholarship and what can the team be doing to support decision making. And one of the things that evolved out of COVID Local and really started to take shape around May, June 2020 was a project called COVID AMP, and analysis and mapping and policies. Emily's nodding her head because she's one of the coders on it now. And that started a process to be able to really create the evidence base for policies and plans and how that maps back to epidemiology. And so that led to another project I'm involved with called Global.Health, which now I think has 60 million epidemiologic line data in it. So this like parallel efforts in academia to build the evidence base, continuing teaching, which was then very much evolved around what was happening in the pandemic. And then this work as like a public health advisor to everybody under the sun. And then in July of 2020, I was asked to join the Biden transition team to work on the COVID team. And as I said before, I'd never been part of any partisan effort before. So somebody had to explain to me what was the difference between the campaign and the transition. But ended up joining that team. It was a small, very hardworking team. I reduced my effort at Georgetown, but I never left Georgetown. So I was still teaching. I was still running the center and keeping the research activities going. And then also, working with the Biden transition team on COVID policies. And that also was this range of everything from kind of our global policies, what does domestic response look like, and also the very practical nuts and bolts of how do we keep the staff who are involved in the transition teams safe and healthy. And so running, like designing the rapid response teams and where should people sit and what masks should people be wearing? And at the same time of thinking of like, okay, and what does a global vaccination strategy look like? So really, really busy time. In January of 2021, I transitioned from the transition team to moving over to the Department of State to be a senior advisor to Secretary Blinken and the global COVID response, as well as global health security efforts at the State Department. Again, I never left Georgetown, so I did this as a side job, and stayed on. And then when Gail Smith came on board as the coordinator for the global COVID response and health security, I became a senior advisor in her shop, and did that through October of 2021, and then left and came back and kind of to reorganize a little bit about what we were doing in the center and what our work was going to be like and how we were supporting other entities. And now just returned back part-time to State Department to help support the negotiation teams for both revising the international health regulations and also thinking about new pandemic treaties. So very much back to the core of my scholarship for a decade and a half, which was focused on that kind of global governance of disease space. So I think that's been kind of the core area of what I've been doing. I've also been trying to have several lines of research that have been going. One is very much focused on this evidence base. So like what works, what doesn't, how do we curate the data that are going to be required to do those analyses from everything from what will be the costs of building country level capacity to be able to better prevent, detect, and respond to public health emergencies. What is the global governance regimes? What should those look like? How do we think about information sharing, and particularly around genomic sequence data? So there's all the pieces that come out of that. So that has been more on the research side, and then also this parallel effort on the government side. And I think now it's really a question of the what comes next. And I think if one of the things that I was able to see on the government side was just how important it is to cultivate a workforce, because global health as a transnational threat is not going anywhere, and making sure that we have people who can do this job that have the right combination of skill sets. So I think very much it's going to be a focus on how do we train the next generation of scholars and of practitioners. So how do we think about that? We had a lot of kind of new entrants to the field over the pandemic, which is really, really exciting because they're bringing disciplinary practices that we've never had. But right now it's an interesting time because we're not sure who's going to stick around and or how many of those kind of disciplines can we long-term integrate into the field. Or so really looking at that a lot right now, thinking about how do we stop the next pandemic, and what does that research agenda look like? So looking at everything from these efforts that we've had underway for years, and how do we integrate different lines of data to support better decision making? How do we better interact with the public, and how do we translate this very academic research into a narrative that the public can understand, can get behind, can actually participate in. And so thinking about different ways to do that. And then, figuring out, yeah, we're not done with the pandemic yet. So how do we actually bring our community together as this community of practice, this thing that we tried to start doing years ago, and how do we now build and build in a way that we can all collectively think about, like, what do we actually have to be doing next? I'm sure I left stuff out, but like I said, it's been a long couple of years and not a lot of sleep.
Oh my gosh, thank you so much for sharing your story and for your time today. And you have held so many roles, and your work has been so incredibly important to ending the pandemic. And, just thank you so much for all of your contributions.
Thank you. And thank you for letting me have this space to talk about it.